So, what does maltracking actually mean? First, you need to understand the word tracking, and you can compare this to a person lying flat, going down in one of those water tubes that you find in water parks, and the person is tracking in the tube or the slide. However, maltracking is better explained by a bicycle wheel that is running against the brake, either because the wheel or brake is misaligned or the wheel has become warped. Your bicycle mechanic can then easily solve the problem and has a solution for fixing the alignment. So when the patella is maltracking, it means that the patella is not tracking normally in the trochlear groove, and in this situation the orthopedic surgeon can help analyze why the kneecap is maltracking. So when the patella is maltracking, the contact area and distribution of load across the patellofemoral joint is altered, and this abnormal kinematics or abnormal patellofemoral contact can trigger cartilage degeneration. It is mostly in the outer part of the patellofemoral joint where the wear is most significant. This is simply because this is in the most loaded part of the joint. Normal patellar tracking is a dynamic process that depends on the degree of knee flexion. When the knee is flexed, the patella undergoes changes in tilt, rotation, and medial lateral position as the knee goes through a range of motion. Some have studied this and found that patients with anterior knee pain have greater patellar tilt and lateral displacement during knee flexion compared to healthy controls. So, what is the reason for maltracking? I think that the perhaps most common cause of maltracking is weakening of the quadriceps muscle, especially the inner side of the quadriceps muscle, called the vastus medial obliquus, or the VMO, is very keen to become weak, especially if the knee is injured or painful, or the leg is kept immobilized for a short while. In those cases, the muscle will become weak and the patella will start to maltrack, and you will become in risk of having anterior knee pain. In those situations, I think it's important to get out of the evil circle and train the quadriceps muscle. Also, the hip muscle seems to react the same way, and I can only recommend that specific knee training guided by a physiotherapist must be done, and in those cases naturally also the hip muscle must be involved. The physiotherapist can not only help you exercising the right muscles, he can also tell you what you should avoid, and he can temporarily help the patella to track more correctly by using tapes, also called McConnel tape. Sometimes a brace can also support the patella and just by this help tracking. Another common factor for maltracking of the patella is hyperpronation of the ankle, because this causes the kneecaps to go inwards, and then insoles can help out the problem, and normally the physiotherapist can help you get the right insoles. However, there may also be some more constitutional problems for maltracking, meaning that your limb is not built the right way. Sometimes the hip is rotated too much inwards, and this can make the kneecaps looking at each other. This is also called miserable malalignment or too much antetorsion of the femur. The antetorsion is reduced when growing, and only in more severe cases this needed to be corrected by surgery, because normally it will sort out everything when you have reached the grown age. So just as the femur can be malrotated, so can the tibia or lower limb be malrotated, and then it's normally too much outwards. And in severe cases, the tibia needs to be internal rotated. A very popular frame or expression is the TTTG distance, or the tuberosity tibia groove distance. This distance is measured on CT or MRI scan, and it tells you how much the attachment point of the patellar tendon, also called the tuberosity tibia, is away from the trochlear groove. Normally this TTGG distance is about 10 to 14 millimeters, but if the tuberosity tibia is externally placed or the trochlear groove is internally placed, as you see in trochlear dysplasia, this distance will become too high and this will tend to maltrack the patella laterally. In cases with trochlear dysplasia, there can also be maltracking. This is since the groove is abnormal, and what you can say is that it's difficult to balance a tennis ball on a football. The J sign is a typical example of maltracking. So what about patella alta? This is when the kneecap is sitting too high, and this is typically not maltracking. It is more that the kneecaps dislocate because the kneecap in those situations is going wrongly inside the groove because it goes laterally, and then you naturally can say that this is severe maltracking when the patella goes out. So how can we evaluate the patellar tracking? First of all, the surgeon can examine the patellar tracking just by observing and manipulating the knee. Also, MRI scans are very useful, and factors such as trochlear dysplasia, patella alta, patellar tilt, TTGG distance can be evaluated by this. In scientific setups, dynamic MRI scan has been used, and the advantage is that in this situation the quadriceps is active and its action on the patella gives a more true picture of what is going on, and moreover the tracking can be evaluated in different degrees of flexion. Those studies has clearly demonstrated that patient having patellar instability has maltracking of the patella compared to normal individuals. Later on, Sheila and I will try to explain more deeply those above mentioned factors that are involved in maltracking and what to do if more than one factor is involved, because then it really becomes complicated. Later on, we will also discuss the surgical options available for dealing with maltracking, such as lateral retinaculum lengthening, tibial tuberosity osteotomy, trochleoplasty, and femoral rotational osteotomy. Thank you.